Following your fat grafting procedure, let's talk about some of the things that you need to know. The major concerns that I think most people have is actually how full the face looks. They can't recognize themselves that first week, and it's so important to understand that it may be psychologically difficult for you to go through that period of time, but it's normal. That healing phase is normal. Hopefully some of the video diaries and other parts of the website will be helpful in you understanding what the psychology goes through during that week. It shouldn't be uncomfortable. The areas that I harvest from could be a little sore, could be a little twingy, but usually that's just for the first week. Sometimes it could last even a few weeks, but the face usually is not uncomfortable, just a bit swollen. Remember that 2 days after the procedure you will look much more swollen. To the point of being extremely distorting, and that's somewhere between the second or third day. Some people have it on the fourth day or the first day, but it will swell up more. I repeat that, it will swell up more. So do not be concerned. That occurs on almost any of my procedures, but more specifically fat grafting. You will swell up more 2 to 3 days afterwards, and do not be disconcerted with that. It is normal. The second thing that's important to understand is that when you smile, it's going to be very hard to smile. This is something that I can't prepare you for unless I tell you this. You're gonna feel like, how come I can't smile? That will come back in about 1 or 2 weeks because of the fullness in the cheek area. When you touch your cheeks or other parts of the face, particularly the cheeks, it'll feel very hard, and that hardness will dissipate over 1 or 2 weeks. So don't be worried when you feel your cheeks and it feels very, very hard. The other thing is important is that sometimes when I fill into this lower area, the line that's around the mouth could get a little bit deeper for the first 1 or 2 weeks. That's very, very important for you to understand as well. Remember what I said on the postoperative sheet, that sometimes one side could be more swollen than the other. That's normal. If you say, oh, is this more swollen this side, what's going on? It's all going to even out. I'm very, 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 very consistent in placing fat evenly on both sides, but you may see one side more swollen than the other. Don't panic, it's normal. And oftentimes when I go back and show you some of the preoperative photographs you already had some pre-existing asymmetries. And I always say that the two sides of the body are not the same and can never be made the same. That's a consent form you sign. So just to repeat that. Remember a few basic things is that you really should not be doing a lot of bending over or heavy weight lifting because it can lead to more swelling. You want to cut down your salt. You want to cut down some of the, a lot of extra fluids, a lot of things that could lead to more swelling in your face. Some ice packing will help during that week, and just rest up a little bit. Try not to do a lot of household busy work. I find some patients that want to go bend over and do some gardening or household chores are the ones that have a prolonged swelling. And those are the real basic ideas I want you to think about after a fat transfer so that you don't feel so disconcerted. And I would like you to try to watch this video a few times to repeat some of the salient points that I've just mentioned.